Hello, healthy mommies. How you all doing? Hope your day is going well. It's a pretty windy day in my part, but we are here to talk about Jaundice. I'm sorry you're going to be hearing some noise right now, but while we wait for the others to join, um, I'm just going to wait for the noise to pass before we start. Hope you're doing well. If you're around, please leave a comment so I can acknowledge your presence before we get into the topic of today. It's going to be a very beautiful topic. So I really hope to get a lot of mothers here. But if I don't, we're still going to go on because I know you will be listening to this at some time or watching this at some time. If you're watching me from Inyango Facebook page, thank you so much for joining. If you're watching from my personal Facebook account, thank you for joining. If you're watching from our YouTube channel, thank you so much for joining. As I said before on our other live streams, I don't get comments here from my personal Facebook account. Neither do I get comments here from YouTube. So if you're on YouTube and you're leaving a comment, I'm only going to see it later and reply to it. So please don't feel like I'm ignoring you. If you're around, please do leave a comment. Let me acknowledge your presence before we go on with the topic of the day. We have a long day. It's a long topic. There is no talking about Jaundice without yellow. So today I'm wearing my yellow top to represent Jaundice. It's going to be a very beautiful session and I know you're going to enjoy it. So we soon go into the topic of the day. Maybe in about 30 seconds, I'll start, hoping the other people will join me. If you're here, please try to share the video because there might be someone who wants to watch, but they don't know how to get there. And maybe there might be someone who is just waiting to see a link or something. So please just try to share as you're going to help a mother out there or a child, right? So I'll be going into the topic in a little while, but first I want to say thank you so much for joining this session, and you're obviously going to learn a thing or two. So I'm going to start right away. I can see Lady Jackie Nanga. Thank you so much for being here. As I said before, it's a windy day in my part, and I'm trying to adjust my book so the wind doesn't blow it. I hope you have your book because I have mine. My book is giving up. Like, it's not even the end of 2021 and my book is already giving up. You're studying so much. That's an indication. I guess so. That's usually what happens when we're in school and maybe you're reading so much the particular book. The book starts giving up and starts crying. So my book is already crying. I hope you have a book which you jot this information inside because it could be of help to you or someone else someday. So let's go right into the topic. Today we are going to be talking about jaundice in newborn babies. Yes, it can happen to adults, but today we are concentrating on jaundice in newborn babies. Please, I beg for a minute so I can. There's a particular mother who begged for me to upload the link of this live session, and please, I wish to do it. You might think it's just a mother, but I feel like it might help her. She might give birth to 4 or 5 children, and it might help those children. Her children might give birth to 4 or 5 children, and it might help those children. They say, teach your mother and you teach your world. So I'm just trying to help a world. Okay, let me just try to share this. I will be done with it in no time. It's just 1 minute. Thank you for your time. Thank you so much for your patience. Okay, let's move on. So, what is jaundice? I'm going to start with the definition. Let me just give a rundown of how we are going to be talking today. I'm going to start with the definition and then move on to the causes and then move on to the types. And then I'll move on to the symptoms and then I'll move on to the treatments and to diagnosis, how you can know your baby has jaundice, and then some tips for parents and caretakers or caregivers to babies, and then we'll be talking about risk factors, things that make a baby more likely to have jaundice, and lastly, we'll be talking about prevention. So you realize it's a long day, so I just have to start right now so I don't waste a lot of time. I decided not to come with my computer's charger or my ring light so that it forces me not to spend so much time. So I'm going to go right ahead into it, and I'm going to be a little bit fast. If you're jotting and if you don't get something, please let me know so that I can get back to it. It will be a pleasure for me. So first, what is jaundice, as I asked before? Jaundice is also known as neonatal jaundice. When we are talking about jaundice in newborn babies, it's also known as neonatal jaundice or neonatal hyper. Please don't mind this name, it's just the name. I'm going to explain everything and we are going to understand. Neonatal hyperbilirubinemia. The name is long, right? Don't worry, I'm going to explain it and we're going to understand. So let's just go on. Those are just the names that it is called. But when I explain, you're going to understand it better. Now, jaundice is a form of yellowish pigmentation on the baby's skin, the eyes, and sometimes on the palate of the baby's mouth. If you watch the cleft lip and palate, just indicate where is the palate in the baby's mouth. I would like to see that in the comment section. If you watched the video on cleft lip and palate, let me know in the comment section where is the palate of the baby's mouth. I will come back to tell you where the palate is. But it is usually, jaundice is usually a pigmentation. Damn. Are you ladies getting me clearly? There is a lot of noise around here. I hope you're getting me clearly. If not, I might have to move a little, but I just hope you're getting what I'm saying clearly, despite the noise. I'm so sorry about it, but there are things I can't really control. Okay, thank you so much. Lady Jackie, where is the palate on a child's mouth? If you watched our cleft lip and palate video, then you should know. So, as I said before, jaundice is some yellowish pigmentation on a baby's eyes, facial skin, and other parts of the body when very severe. Okay, so it could, as I said, it stains the eyes, like not the black part of the eye, the white part of the eye. So when you look at the baby's eyes, you can easily realize that a baby has jaundice. Okay, now first signs of jaundice occurs within 2 to 4 days after birth. And jaundice, which is mild and normally occurs with most babies, would clear by itself within 1 to 2 weeks. As we go on, I'm going to tell you how and why it clears up by itself, and also why is there this yellowish pigmentation. I'm going to try to explain everything as we go on. Now, 60% of babies born full term, like 60% of all babies born normally and in the right time, get jaundice. And 80% of babies who are born prematurely get jaundice. Like, you hear the numbers are so high. The numbers are so high. Oh, sorry. Cleft lip is on the lip, but cleft palate is under, like inside the upper part of the mouth. Thank you for your contribution. Okay, so with jaundice, you can also see some yellowish pigmentation in the baby's palate. The palate is supposed to be some pink. Yeah, she got it right. Thumbs up for you. Okay, so in jaundice, you can get it on the upper part of the baby's mouth and the white part of the eyes. And when it just starts on the face, as it progresses, it goes down to different parts of the body. While I think during the day, I sent a post on the different grades of jaundice. So if you did not see that post, please, after this, go there and check that post to see how jaundice can progress to the baby's body. But for now, let's go on. So jaundice is generally a yellow like my blouse, yellow pigmentation. Maybe not this light, but yellow. So now, what are the causes of jaundice? As I begin to speak and go further, you're going to understand more what jaundice is all about. But in the beginning, it can sound a little bit complicated. But as I go further, you're going to understand. So just stick with me as we go on. So now, the yellowish discoloration is caused by buildup of yellowish bile pigment called bilirubin in the blood. Now, bilirubin is some kind of substance. As I said, as we go on, you're going to understand better. So let me just keep going on. I'm going to repeat that. The yellowish discoloration caused by jaundice is as a result of build-up yellowish bile pigment called bilirubin in the blood. Now, maybe someone might ask me what is bile, but I usually hear us say, my friend, you get bile. Like when we speak in pidgin, we usually say bile, but most times we don't really know what bile is. In a chicken, you know that green stuff is mostly chicken that we have seen the inside. Most of us eat chicken. The green stuff which is inside the chicken's liver, which people used to call it bitter, or they say when if you kind of burst it without removing it from the chicken, the whole of the chicken is going to be bitter. I don't know if that is true, but that greenish thing, that is the bile. It is found inside the liver. Even in human beings, that is where it is found. So we go on. Now, you might ask me, what is bilirubin? Bilirubin is essentially a natural occurring waste product that forms when your body breaks down old damaged red blood cells to make new ones. So I try to jot these things down in my own words, in very simple words. That's why I go back to read and then I'll come to explain. Because if I jot it down like the way they say it from the research I do, we will not understand it. So I try to read and then go and get the definitions of different words and then put it down in simple words, then I can explain. So as I said, bilirubin is essentially a natural occurring waste product that forms when your body breaks down old damaged red blood cells to make new ones. For example, I like using examples, please forgive me, it's just for easy understanding. If you've ever washed bitter leaf before, or you've washed, more often bitter leaf, and you're washing it under a tap, when you wash and wash and wash, and you squeeze out that bitter green liquid that comes out of it, and maybe you do it under a tap, you realize that it kind of dissolves, and that is what helps for the bitterness of the bitter leaf to come out. So that is like the process of you hearing damaged red blood cells, the body releasing it, and it turns to bilirubin, which is some kind of substance which is yellowish, and then it leads to jaundice. So if you're washing bitter leaf, you're diluting it, you're getting the water out, and you're left with your good bitter leaf which you want to use to clean. So what comes out from the bitter leaf is damaged, is some damaged liquid. It's because you are damaging the bitter leaf by washing. That is the reason why that liquid comes out. And as it comes out, it leaves that particular product which you want to use to cook. I'm using examples which concern things which concern food because I know I'm talking to women and they'll understand better. So say, for example, this the bitter leaf which is left is the blood which your body needs. And the bitter water which comes out is the damaged red blood cells, which you don't need. That is why it is going out. So when the body produces much of this bilirubin from the breaking down of damaged red blood cells, and then it doesn't flow out, it causes a problem. That is what causes that pigmentation. For example, you wash bitter leaf, you're washing the bitter leaf, and you're not rinsing it with clean water. It's going to stay bitter, right? And when it stays bitter, you don't get the result of what you want to use to cook. So that is a simple explanation, which I think makes it simple for us mothers to understand. So as you wash, if you want your nice bitter leaf to remain, you have to keep rinsing. If you don't rinse, The bitter water remains in the bitter leaf, which in this case in the body, that is bilirubin, which forms jaundice. So this bilirubin is just some waste product that when it stays in the body, it causes a problem. When it goes out, you're all fine. Yeah, so that is what it is. Now, that's one of the main causes of jaundice, excess bilirubin in the body, which is not sent out through the liver. Now, why do babies get jaundice? Though, yes, jaundice can happen to older people, but most times babies get jaundice because their livers are not yet mature enough to process these things as fast as they're supposed to be processed, right? That is why children who are born preterm are more likely to have jaundice because their livers are even less developed compared to children who are born full term. So another cause of jaundice, of neonatal jaundice, is because the baby's lungs are not strong enough to process these damaged red blood cells fast enough to send the bilirubin out of the body. So we can say in our bitter leaf example that the baby's body is not yet strong enough to flush, like the water going through the bitter leaf and all that. The baby's body is not yet that strong. So I hope you get it. And another very important cause is that the baby's body is in such a way that since the livers are not well developed, there are less bowel movements. So the baby does not stool as often as a normal person will stool. For a normal healthy person, the liver can process these things and remove the bilirubin and they are going to be fine. But for a baby whose organs are not yet fully mature to process these things as fast as it's supposed to be, then there might be this problem. So now, let me explain this bilirubin thing a little bit further. Now, it is said that red blood cells contain... Okay, thank you so much for the question. I'm going to get to it. Red blood cells contain an oxygen-carrying protein called hemoglobin, which is converted into bilirubin inside the liver. During the breakdown of damaged red blood cells. So that is typically what happens. The spelling is Bilirubin. Bilirubin, not Belorubin. Bilirubin. Okay, I don't know if I'm pronouncing it well anyways. I'm not a medical student. And with this, I read most of the time about it. So that's typically the causes of jaundice. Now, you asked what hinders bilirubin from flushing out. I'll get to that in a minute. Let's just keep going. You are going to give me an answer for this as we keep going. Now, I'm going to talk about the types of jaundice. Since we've already talked about the causes of jaundice, which is because of high bilirubin in the blood streams, which are not flushed out. Also because the baby's liver is not yet mature enough to process damaged red blood cells as fast as they are supposed to go out of the body, and also because babies have less bowel movement. Now, talking about the types of jaundice, there are two main types, but there are other types. There are two other types, but the two main types are physiological and pathological. Physiological is the very common type of jaundice, which happens in most babies, but this type is mostly mild and is due to the normal cause, which is due to liver not being well developed to remove the bilirubin from the bloodstreams, either through poop or through urine. Now, talking about pathological jaundice is very rare. It's more rare compared to physiological jaundice, and it is caused by, yes, it can be caused by the liver not being well developed, but it is also caused by other factors, which are hypothyroidism. This is when your thyroids don't produce enough thyroid hormones into your bloodstreams. Thyroids are actually found around here under your Adam's apple. or is in front of your Adam's apple, but it is found somewhere around here on your neck. And when you have thyroid problems, it's mostly shown on your nails, your hands. You are more likely to have nail issues, maybe fungi, your nails coming up, you having the vertical lines on your nails. Yeah, that's how thyroid issues indicate. Now, okay, I said the first cause of pathological jaundice, which is rare, is hypothyroidism. The second one is rhesus factors. I think I've talked about this in some other video and explained it more, but I'll go into it as we go on. Rhesus factor disease. Another thing which can cause jaundice is anemia, which is shortage of blood. Another cause of pathological jaundice is some hereditary conditions, like in families where their babies are more likely, like they had future babies who had jaundice, it's more common for it to reoccur in other babies. Now, some defects in the bile or gallbladder can also cause jaundice. Now, the third type of jaundice, which is also very mild, is breastfeeding jaundice. This is a moderate form of physiological jaundice. As I said, it is mild. Now, a baby can get jaundice just by breastfeeding when not done in the right way. Now, jaundice can develop in a newborn baby because the baby might not be getting enough nutrients and fluid from the breast milk, which is as a result of the mother not producing enough breast milk. Most times when babies are born, the breast milk doesn't start coming immediately because most times in Africa, when we give birth, our babies are not put on us to suck on our breast immediately. So that particular gap which is given, especially for CS moms, can make it in a way that the baby does not get enough nutrients since the baby is not taking enough fluids and nutrients from breastfeeding. So babies who suck from the bottle are more likely to not experience jaundice, but babies who suck from breast milk are more likely to suffer from jaundice because they are learning to suck. They are learning and struggling on how to get the perfect latch. You, the mother as well, you don't know how to get the perfect latch. So you're both struggling, which is why I will really advise for mothers to learn how to breastfeed on time so that at least it's just once as you, the bigger person, knows what to do, it's a little bit easier for the baby to understand what to do. Because if your baby is not getting enough breast milk and enough fluids, then jaundice is more likely to occur because bilirubin, which is formed when red blood cells break down, is flushed with stool and urine. If there is no water in the system, there is no waste in the system, then there will not be poop, there will not be so much urine, so bilirubin stays in the body. That answers your question, Lady Jackie. So, another type of now, I'd like to let us know that 1/6 of all breastfeeding babies during their first weeks after birth get breastfeeding jaundice, but it is very mild. And as you keep breastfeeding, or you keep giving formula, if you turn to start giving formula because your breast is not flowing, it would cure itself. It will resolve itself. Now, another type of jaundice is breast milk jaundice. It is a lot related to breast milk breastfeeding because your body has to flush these things, like the water which goes into the bitter leaf and then the dirty water or the bitter water goes out for you to get your good bitter leaf. Yeah, you have to get in enough breast milk to make sure that the baby is sending out enough waste for these waste products to get out of the baby. That's the only way you can get out. So breast milk jaundice is jaundice which might occur around the 2nd or 3rd week of the baby's life, and it is usually caused by breast milk because the way breast milk was made, it was made in a kind of way that it is just sufficient enough for the baby. So most times when the baby is sucking, the baby might just get enough nutrients which the baby needs, and the baby might not pass out so much stool or might not urinate so much. So just the substances in breast milk can cause a mild form of jaundice, which is totally manageable and I won't call for any alarm and can be resolved at home with you just continuing to breastfeed. Now, doctors always recommend that mothers continue to breastfeed, whether the baby has breastfeeding, breast milk jaundice, or physiological or pathological jaundice, because you breastfeeding your baby increases the chance of the jaundice resolving itself. So now let's go on to talk about some symptoms. Now, symptoms would depend on whether it is mild or severe. For mild jaundice, some symptoms will include yellowish tint in the skin, yellowish tint in the eyes, like the eyes looking a little bit yellowish, discoloration, which is more pronounced when you press the baby's skin. So some few ways that you can diagnose jaundice as a mother at home is by pressing your baby's skin. So when you press your baby's skin for newborns, most time it's going to be white. But when you press a baby with jaundice, the skin looks yellowish. So you can easily discover that your baby has jaundice. Or you look at your baby's eyes, they'll be kind of yellowish as well. So the wind, it seems as if it's about to rain here. So now for moderate to severe jaundice, you might encounter things like low appetite in your baby, increased drowsiness, like your baby just wants to sleep all the time, restlessness, more irritable than usual, like your baby gets more irritable. Any little thing makes them cry. Dark yellowish urine is also an indication. Light colored or pale stool. As you keep giving your baby breast milk, your baby's stool is going to change from dark green, which is the color of the liquid in the bile, from dark green to yellow, which means that it is your baby's body is sending out the bilirubin well enough. But if your baby's stool is still pale, not looking yellowish, they should be storing bilirubin, which is not good for them. Now, another thing is aching on the back. Your baby's back might be aching. When a baby has a lot of discomfort, they cry in very, very high pitch. Like, I cannot imitate it, but they cry in such a way that you can hear their voice from so far away, and you just know that this baby is not okay. So it is good for us mothers to be very conscious, to monitor your baby well enough, so when there's a problem, you can identify it first, because as a mother, you're the first doctor for your baby. Now, let's go on to treatment. Treatment will really depend on the severity of the jaundice. Now, for mild jaundice, it will generally resolve itself within the first 2 weeks of birth, right? But for now moderate or severe jaundice, other things need to be done. This is what needs to be done if your baby has moderate jaundice. And how do you know that your baby has moderate jaundice? I'll talk about that in diagnosis. Or maybe I should get to diagnosis before treatment. Okay, for diagnosis, for how a doctor can diagnose jaundice, it is done through a bilirubin check, because the first thing which causes jaundice is high bilirubin in the blood. So they will normally take the baby's blood sample and test it for the levels of bilirubin. And if the baby's bilirubin is high, they know that they have to start dealing with the jaundice immediately. Now, another thing which they can do is, I'm sure you've seen these thermometers which came out due to COVID. Yeah, they have something like a light bulb, which is like that you can put on the baby's head, and it will be able to tell you the levels of bilirubin in the baby's blood. But doctors usually do this before they have to go and take blood from the baby's hands or wherever to test for bilirubin levels. So that's how it is diagnosed. Now for treatment, after the doctor has done this test, they will now know the level of bilirubin, and then they'll determine if it is mild, moderate, or severe. As I said before, if it is mild, normally it will resolve itself within a few days or the first 2 weeks of birth. But if it is moderate, there is phototherapy which is done. If you look at the pictures of phototherapy, it looks very beautiful, but it is not something done in a beautiful situation. Now, there are two main types of phototherapy, which are conventional, and fiber optic phototherapy. Now, conventional phototherapy is when the baby is put into some kind of incubator-like box with a blue fluorescent light, which is put on the baby's body. With the conventional phototherapy, The baby is usually put a little mask on the eyes, like what we use to sleep. Yes, and then they are put into that incubator like box for the light to really get in contact with their body. What this light does is it turns bilirubin into a more simple form, which is easier for the baby's liver to process and sending out through urine and stool. So it just works on the bilirubin, takes it from the level which it is. If it was maybe too strong, it reduces it to a simpler level that the baby's liver can process it and send it out. So with fiber optic phototherapy, they use something like a blanket which has a lot of fibers and cables inside of it to cover the baby up, so that the light is actually in the blanket. So they use the blanket to cover the baby up, while in most cases the mother breastfeeds the baby while it's going on, and when she's done breastfeeding, they can wrap up the baby fully with this blanket. It does the same thing as conventional phototherapy. Now, babies who undergo phototherapy, for every artificial thing which happens to a human body, there are after effects. Babies who go through phototherapy are usually very prone to dehydration, so they are usually put on drips. So if you see a baby in the conventional phototherapy box, and then the baby has drips passing through the body, you feel like, oh my god, this baby is going through so much. But those infusions is just to help the baby to get fluids while the process is going on, because it can lead to dehydration, which is one thing which you don't want a baby to have. Now also, phototherapy, either one of them, will lead to constant greenish poop. The baby will poo very much, which is a way of the bilirubin going out. As I said before, bilirubin is processed and sent out through either poop or urine. So in a baby who is going through phototherapy, they'll have a lot of greenish poop being sent out, and also many wet diapers. But after the pediatrician sees that the case is being resolved by testing the baby's blood, they will take the baby out of the machine, because it's not so good for the baby to stay there for so long. Now, for very severe cases of jaundice, there is usually this case where there is a blood exchange which is supposed to be done. And very severe cases of jaundice happen mostly to babies who have a different blood group from their mother, or their rhesus factor is different from their mother's own. So, for example, most mothers have positive blood groups. So it can either be O positive, A positive, B positive, AB positive. Yeah. If a baby has a negative rhesus factor, right, it's going to be a problem, because the mother's blood after birth acts in the baby's body, because normally the mother and the baby's blood keep exchanging when the baby is in the body through the placenta. So when the baby is born, the remaining part of the mother's blood which entered the baby before the baby is born acts in the baby's body as antibodies. So it keeps fighting the baby's red blood cells and damaging them in such a way that, since most of the baby's red blood cells are being damaged, it needs to be released. Because when they are damaged, it forms to bilirubin, and then it needs to be released out of the body. But if the mother's blood, which remains in the baby's body, which forms antibodies, and is fighting the baby's blood, keeps fighting it and keeps damaging the baby's red blood cells, then there is far more bilirubin to be sent out than the baby can process. So this can cause very severe jaundice. Now, in these cases, they might have to exchange the baby's blood generally with the blood of a donor who has healthy blood. Like, it is such a complicated situation that I think for African moms, if that kind of thing happens to them, they'll be like, this is witchcraft. But there is some medical explanation to it. It's not always witchcraft. At times, it's just little things which we can control if we are informed about. So now I have talked about the 3 different cases and their treatments. Let's go on to tips for parents and caretakers. These tips can help you prevent jaundice. Now, some tips which I have for you are: check your baby's skin and eyes daily in bright natural light. Don't stay in the house and check your baby's skin, because at times even the bulbs in the house are yellowish. And also, this is now the reason why our mothers say we shouldn't wear yellow around a baby. Let me just spell it out for you to understand. Now, if you want to check your baby's skin or your baby's eyes, for example, if you look at my glasses, my screen is reflecting in my glasses. Even if I remove my glasses, you realize that my screen is reflecting in my eyes. It's not really reflecting that perfectly because I don't have bright daylight here. But in the case where I have bright daylight, if I'm looking through a screen, or if you're taking a photo, you realize that the reflection of the flash goes to your eyes. So if somebody is wearing a yellow dress around the baby, at that point which they are checking for jaundice, it might reflect in the baby's eyes, and the mother will feel that the baby has jaundice, of which the baby doesn't have. So that is the main reason why mothers say you shouldn't wear yellow dresses around a baby, because jaundice is an emergency for babies, especially when it starts indicating their eyes looking yellowish, their skin looking yellowish. It's an emergency. So you don't want your baby to show signs of jaundice if there is no jaundice there. And yellow dresses around your babies might cause your baby to reflect the yellowness of the dress through their eyes, which might make you feel your baby has jaundice when they don't have. So yellow dresses don't cause jaundice, but they might give a reflection in the baby's eyes, which might make it seem like the baby has jaundice when the baby doesn't have it. So that's simply it. It's not like yellow objects cause jaundice. No, there's no relationship. But if you want to go and argue this with your mother, you're on your own, because she will obviously argue you. She'll obviously be very ready to argue you till the end. So if you want to go and argue with your mom, you're on your own. I'm not there. Or you can just show her the video, but know that you will get things like, so you want to tell me, say me, I bring you for the well, you know, pass me. So please, if you want to explain it to your mother, look for a good way to tell her that will not make her feel like she doesn't know what she's saying, because they actually know what she's saying. I really love the information that we get from our mothers, because even without them knowing anything about jaundice, they know what to tell you so that you don't make your baby indicate jaundice when there is no jaundice there. So that is it about yellow clothes, yellow objects, and jaundice. Yellow objects doesn't really cause jaundice. But our mothers just don't want you to see your baby's eyes and think he or she has jaundice when they don't have. And that is a good thing. So please don't wear yellow dresses around babies. I support that one. I stand with my mom. Okay, now on to the second tip. It is harder to see this pigmentation in dark-skinned babies. So check the eye white. Check the eye white. It is very important to check the eye white. Which is why, again, you don't want to wear yellow dresses beside your baby, because if you're checking the eye white when you're wearing a yellow dress, you will say your baby has jaundice when there is no jaundice. So it's smart. Now, tell your pediatrician if you see any yellowish pigmentation or any changes in your baby. Now, another thing you can do, which is the fourth thing, is if your child has jaundice in the first 23 hours of life, it is an emergency. Go to the hospital immediately. If you realize your baby's eyes are getting yellow, you're touching your baby's body, it is yellow, please don't wait. Our medical system is very slow. So immediately take your baby to the hospital, because it is an emergency. Another tip is make sure your baby is well fed to keep jaundice from worsening. Even when you suspect breastfeeding may have been the cause of jaundice, make sure your baby is well fed. Feed them, because for bilirubin to go out of the body, there needs to be something entering the body. For you to stool or go to the restroom, you need to be eating, right? If you stay the whole day without drinking water, you won't pee, which means your body is retaining all the waste in there. So make sure your baby is taking in enough breast milk or formula if the baby is taking that. Now, another thing is exposing. Now, this is a very controversial point. So please listen to it keenly, and if you have questions, I'll be happy to clarify. Now, exposing babies to direct sunlight for long periods is not a treatment for jaundice. I had to do a lot of research on this one because I myself were told at some point to take our babies out in the sun as it can help with jaundice and all. Yes, it can help, but it's not a treatment because if you even stay out with your baby in the sun for longer periods, it can lead to sunburn, dehydration, because you stay out in the sun for so long, you're sweating more, you're losing more water. It might cause dehydration, which is not good for the baby. So being in the sun for shorter periods might help, but a treatment for jaundice, especially when it has gotten to moderate or severe, is phototherapy, not you staying in the sun. So as I said before, feed frequently. Make sure your baby has the appropriate number of wet diapers. So a baby will normally have between 6 to 8 wet diapers in a day if they are well hydrated. So if your baby is having less, please breastfeed more. I know this is hard and might be difficult for mothers because there are times which you have nipples sore, your breasts are paining and all, which is why we have a post which I sent in, I think, yesterday. Please go and read it so your breast is in full form to keep breastfeeding your baby, because just you breastfeeding is fighting a lot of sicknesses in your baby. Now, you can also monitor your baby's stool so that it when it changes from green to yellowish to the mustard color, like really yellowish poo, that is a good sign that your baby is sending enough bilirubin out. If your baby's stool is pale or dark brown, then there might be some little complications. You might just need to breastfeed as often as you can. Now, let's talk about risk factors. We are almost at the end of this session. Thank God. Some risk factors include premature delivery. As I said before, babies who are born below 35 weeks of age, normally they are not full term, so their organs are not fully developed. And one of these organs is the liver, which is not fully developed. And because of this, it might not be mature enough to process all the red blood cells, which might be broken down. Also, because when a baby leaves the womb, like the body adapts so fast to start surviving on its own. So it might break down a lot of waste and then tries to produce new ones which your baby can survive on. So just make sure you're feeding your baby enough. And if your baby was delivered premature, please make sure your baby is hydrated. In fact, it's just something for the health caregivers to take care of. But as a mother, always try to check on your baby, understand what is going on in the incubator. If you're a mother, try to always check, because our medical facilities here, if you are not following the medical personnel behind, they might not do the right thing, even though they know what the right thing is. Now, another thing which puts babies at high risk of jaundice is incompatibility with the mother's blood type or different rhesus values. As I explained earlier, if you are maybe AB positive and your baby is AB negative, the negative and positive are the rhesus values or rhesus factors. So if the one you have and the one your baby has are different, then it might be a problem. This is one reason why we have to start antenatals very, very early, so that they can dictate these things. And you even before even antenatals, when you get married, please check with your husband, check your blood, check those things. It might be expensive to do, but it is for the health of your baby, your future babies, your future generation. Okay, so please check for these things to just clear it out, so that you know you're going to give birth to healthy babies. And in a case where, yes, there is those kind of complications, you are aware from the beginning that your babies might not be so healthy, and you might start doing some research and knowing what you're going into and what you can do. So another risk factor is, I talked about this 2-in-1 incompatibility blood type between mother and baby, and babies who don't share the same blood group or HR factor, which is rhesus factor, with the mother. Now, another risk factor is, it's just an more explanation on what I talked about rhesus factors. Because when the mother's blood is not compatible with the baby's blood, by the time the baby is born, the mother's blood acts as antibodies and it targets the baby's red blood cells and then starts damaging them. And then when they are damaged, it forms bilirubin, which needs to be sent out of the body as fast as possible so it does not cause a problem, since bilirubin is waste. So another risk factor is bruising. With this, I would give an example, like, for example, when you have, maybe you hit your hand somewhere or you have a wound, your red blood cells or the cells in your body rush very fast to that area to heal it. So while they rush fast to that area, it might even cause an alarm in the body which is not supposed to be there. So though we will usually see that, yes, the mother pushes out the baby and the baby comes out so smoothly and nicely, there are times which there are bruises. For example, if you press your hand so tightly for example, if I use my pen on my hand like this for too long, you'll see that there's some discoloration on that point. So there might be bruises when you don't even know there are bruises, okay? So if you have to exercise, please do it because it helps in that pushing process. Just prepare yourself for birth as much as possible. Go online, look for lessons on how to push so that it helps you and saves your baby from bruises which might later cause jaundice, okay? Because when there is a bruise, the red blood cells around that area are damaged and the body needs to produce more. And when they are damaged, bilirubin sets in and other things. So that's it. Another risk factor is other things like hereditary jaundice. In a family which had babies with jaundice, or if your mom had jaundice when she was younger, you could also have jaundice. If there are other babies in the family with jaundice, you could also have jaundice because it shows that maybe there is some kind of liver problem which does not enable the body to send out those waste as fast as possible. Welcome, Lady Fidel. Thank you so much for joining, Lady Vera. You're welcome. Okay, I think we are done with everything. Thank you. I think we're done with everything. When I was talking about jaundice, I also indicated some complication which comes from jaundice. When jaundice is not treated or not managed well and it gets very severe, it can lead to brain damage. And this brain damage might come up with a lot of things. It's the brain that controls so many parts of you. In fact, it's the brain that controls your whole body. So if the brain starts getting damaged, you might see cases like the baby having problems with the vision, the baby having hearing problems, the baby not walking, the baby not talking properly. Because if the brain is damaged, the whole body is damaged. So a very big complication which comes up as a result of severe jaundice or acute bilirubin is brain damage, which is also called kernicterus. Yeah, that's a very huge complication which comes as a result of jaundice. So at times I might not get the pronunciations right. Please permit me. I'm not a medical student. I'm not a medical personnel. I'm just a mother who cares about her children and other children in the world, and other mothers as well. And I believe that mothers are the first doctors to their babies, because before you get to the hospital and get a doctor to attend to your baby, you must have seen what is going on in your baby, and there is something you can do. And I believe that knowledge is power. And if I can learn these things, I don't need to know how to pronounce the names. I just need to understand what is going on. You don't need to understand or know how to pronounce the names. You're not a teacher. You're not going to teach this out to some people. Even though I'm teaching here, I don't need to know the pronunciations and pronounce it right. Most of these names come from different languages, which might not be my primary language or your primary language. What you need to know is understand the issues, such that if it happens to you, you can be of help to yourself first before you get to a doctor. In most of our hospitals, when you get to the hospital, you first of all get nurses who maybe start checking BP, checking temperature before the doctor will come. If it's a severe situation, your loved one must have passed away. So if there is something that you need to do as first aid, you can only do first aid for a particular situation when you have understood that situation, or you might be doing something which is worse. So we have to get this information and fill ourselves with so much knowledge, because life is so unpredictable. Today you can be fine, tomorrow something might come up. So as mothers, we need to get this knowledge. And I feel like the business of manufacturing our next generation is taken so lightly. I might have to put it this way so it sounds serious. Babies being born, motherhood as a whole, is the process of manufacturing our next generation. Imagine if we don't have all the knowledge about all the things that can go wrong in this life, which is so unpredictable. Imagine how more things will go wrong. So we just need to be aware. And please don't keep it to yourself. I learned by teaching, and I believe that you can retain these things in your mind, and they'll help you in future by teaching someone. So if you've learned something here, please teach someone, because it's going to help a mother, it's going to help a baby. We are the machines which manufacture the next generation. We are privileged to be the ones. So if we are okay and we have so much information and we can share to other mothers, and if mothers are equipped, if the machine that produces the next generation is so equipped and strong, then we have a better next generation. If not, the generation that comes next will be worse than none. So thank you so much for joining today. I hope you learned something. And I hope you can teach this to some other mother. And I hope you can convince your mother that the yellow dress doesn't cause jaundice. It's just the reflection in the eyes which might indicate jaundice when there is no jaundice. That is why we shouldn't wear yellow dresses. I hope you can convince your mother. I won't try to convince mine, because it's going to be a very difficult task, I know. So I hope if you're going in for that journey, I hope you can. But for me, maybe I'll convince her when she comes around. I'll convince her when she comes around, not through the phone or through anything, because it might be very difficult. So one way to keep jaundice away is by breastfeeding your baby. Just breastfeed so that you get enough nutrients as possible. But if we need to breastfeed, then we need to be eating well enough, eat enough vegetables, keep yourself well hydrated, be fine mentally, because everything starts from the brain. If you're not fine mentally, then you might not be able to make enough breast milk, because everything starts from the brain. So relax, chill. No matter what you're going through, life happens, and time heals all wounds and solves all problems. Just give it some time and you're going to be okay. So relax. For the sake of your baby, please be calm. Eat enough fruits and vegetables, eat enough healthy foods, and drink enough water so you can make enough breast milk, so your baby can get enough nutrients and fluids so they can flush out bilirubin and flush out jaundice. And with that, that will be the end of this session. Okay, thank you so much, everyone who joined. Let me just acknowledge you, ladies. Thank you so much. Lady Jackie Enanga, thank you for always being here. Lady Vera, you're such a darling. Thank you so much for always being here. Lady Ebenya Fidel, thank you for joining. It's better to be late than never. Yeah, I think those are the people that joined who actually left comments. For those who didn't leave comments, I'm sorry I can't see you. And for those who joined with my personal Facebook account, thank you so much for joining. For those who are watching from YouTube, thank you so much for joining. I'm going to get there and check your comments and make sure to like them. Thank you so much for joining. And please, if you're here, share this video. Don't keep it to yourself, because you might be saving the life of a mother and a child. It might be your own little impact which you are making in the world, but every little impact is important. in raising healthy, wealthy, and exemplary moms. It all starts from us. Do have a beautiful evening, and may God bless you all, your homes, your families, your kids, everyone you know, to have a beautiful evening. I hope you learned something and you can teach someone. If you have questions, please don't hesitate to send them to our inbox or leave it under this live. I would obviously find time to come back and check. Or you can send them to my inbox on Larissa Livella on any social media platform. I'm Larissa Livella on all social media platforms. Facebook, Instagram, what else? LinkedIn, Twitter, everything. If you have questions, send it anywhere that you can. So do have a beautiful evening. May God bless you. I hope you learned something. And just wish you the best. Thank you for joining. Have a nice evening. Bye bye.